Hi, I'm Dr. Linda Lee. I'm a licensed care of the elderly physician, and my focus is in dementia care, helping those living with dementia and their family members to live their best lives possible. Have you ever wondered if you should get a memory test? Or maybe it's someone you care about who's getting a bit more forgetful, and you're wondering, should they get a memory test? If so, this video is for you. Now, if you're new to this channel, welcome. You can check out more resources at plumtreememory.ca, and I'll have all the links to resources down below. So let's begin. To date, there haven't been any recommendations for broad-based screening. And what I mean by that is there haven't been recommendations that we should be doing screening tests for dementia in people who don't have symptoms or signs being at risk for having memory problems. And that has been for good reasons, but that may change, especially as we get new treatments that are designed for people who have earlier stages of memory loss. But most guidelines do recommend getting testing if there's good reason to test. And that's what today's video is about. Who would benefit from having cognitive screening tests done for memory problems? The one thing I do want to emphasize is that cognitive screening tests are only screening tests. They are not diagnostic tools. They don't make a diagnosis of dementia. They only increase or decrease the likelihood that the person may have a memory problem such as dementia. So they're not diagnostic. And screening tests are not foolproof. They overcall it, they may undercall it. It's only one piece of information. An accurate diagnosis of dementia requires many pieces of information, not just the screening test results, but other pieces of information like the story of the progression of the symptoms that you're noticing, how quickly it's getting worse, what kinds of memory symptoms you have. And there may be a physical examination component, and often there are other investigations that are needed, such as head imaging or blood tests. So screening tests are only one part of the puzzle. There are many pieces of information that go together to make a diagnosis of dementia. With that said, there are some situations where memory testing could be helpful and make sense, and we'll get into that. But first, let's talk about normal aging, normal cognitive aging. We look at memory as a spectrum. There's a normal amount of memory loss everyone gets as they get older. On this end is dementia, and in the middle is a zone we call mild cognitive impairment. And we're going to do a video on that, but let's talk about normal memory loss. There are some changes that we know are normal as people get older. Our processing speed is about half in our 70s as it is in our 20s. That means it's going to take longer to put new information in and longer to retrieve it. That's part of normal aging. That tip of the tongue phenomenon, maybe you've noticed that, where it's harder to pull out that word that you want to say, and typically will be capital letter words, proper nouns, names of cities, street names, people's names. It takes longer to pull that out, but eventually you get that. That's part of normal aging. What is not normal is if there are gaps in the memory. There should not be any gaps. There shouldn't be conversations or events that have happened that there is no recollection of. There shouldn't be getting lost in familiar environments and repetitive questions and statements as if the conversation didn't happen, even when you give them reminders of it. That might be a worrisome sign. The memory loss shouldn't be affecting your day-to-day functioning. That's worth getting checked out. And the other thing I want to emphasize is that it's not just dementia that can cause memory loss symptoms. There are many other causes. There are medical conditions, there's medications, there's many other things that can affect your memory. So it's really important to get that checked out, and your doctor will run some tests to sort out the cause of your memory loss symptoms. Bottom line, my take-home message is this. If you are worried about your memory, or others are worried about your memory, it is good to get it checked out. There may be things that others are noticing about us that we can't notice ourselves. In my experience, if others are worried about a person's memory, often they're right. Get some memory testing done and see your doctor for other investigations that might help to sort out the cause of those memory symptoms. Sometimes these are causes that can be reversed. There might be medications that you're taking that are adversely affecting cognition. There might be other medical conditions involved. And if it is a memory loss problem, with early diagnosis, sometimes there are interventions that can help to slow down memory loss or maybe improve memory loss. There might be some lifestyle interventions that might be helpful, and we'll do a video about some of these lifestyle interventions. So that's it for now. If you like this video, hit the like button, click on subscribe, and share this video with others you think might benefit from some credible evidence-based information on dementia care. And if there are topics you want to hear about, or questions that you have, please put them down below in the comment section and we'll try to address them in future videos. Take care.